Caution. Under United States federal law, the devices shown in this video may be sold or distributed only to a licensed physician or other licensed healthcare professional who has been trained in the use of the Provox NID voice rehabilitation system. This video introduces the Provox NID voice rehabilitation system and illustrates important user instructions. The video does not replace, nor does it set forth, the complete contents of the user manual and/or prescriber information for the Provox NID voice rehabilitation system and is not a substitute for reviewing and understanding that important information. Therefore, before prescribing and/or using the Provox NID, please review the entire contents of the user manual and/or prescriber information for the Provox NID voice rehabilitation system. User manual and prescriber information are available online at www.atosmedical.com. You may also obtain a copy by calling 1-800-217-0025 in the USA, sending an email to info@atosmedical.com or writing to Atos Medical AB, PO Box 183 24222 Hörby, Sweden. In addition, copies of the user manual and/or prescriber information can be obtained at your supplier of Provox products. Provox NID Voice prosthesis for rehabilitation after total laryngectomy. The choice you've been waiting for. What is Provox NID? The Provox NID voice rehabilitation system is intended to be used for prosthetic voice rehabilitation after total laryngectomy. For nearly 2 decades, clinicians and patients from all over the world have recommended and used our indwelling Provox voice prosthesis because of its excellent functionality, reliability, and safety. However, many people have also asked for a voice prosthesis that has the same features as the Provox, which patients can insert, remove, and clean themselves. Atos Medical is pleased to offer the Provox NID, the choice you've been waiting for. The Provox NID voice prosthesis is available in 2 outer shaft diameters, 17 and 20 French, and in several lengths. Each prosthesis comes individually packaged with a non-sterile, reusable NID inserter. A full range of accessories is available for the care and maintenance of the Provox NID. These accessories include the Provox Dilator for dilation of the fistula prior to insertion, the Provox Brush and Provox Flush for daily cleaning, and the Provox NID Storage Box for convenient storage. All accessories are available in different diameters and sizes corresponding to the diameter and length of the prosthesis used. User instructions. When you receive the Provox NID from your clinician or when the product arrives at your home, immediately inspect the package and check if you have received the correct prosthesis size. You must never use a product if the package is damaged or opened. The Provox NID prosthesis is intended for use in a single patient and may be used for a maximum period of 6 months if it functions properly and has no structural damage. If the prosthesis doesn't function properly and cleaning does not improve its effectiveness, then you should stop using it and replace it with a new prosthesis immediately. This means, prior to each use, you must always ensure that your prosthesis is intact. Make sure that the prosthesis body and flanges are intact and that there are no tears, cracks, crusts, or other structural damage. Inspecting the prosthesis prior to use helps reduce the risk of fistula damage and/or loss of the prosthesis into the trachea or esophagus. Make sure that the valve flap of the prosthesis closes against the valve seat. If the valve flap does not close against the valve seat, do not use the prosthesis and instead immediately obtain a replacement. Improper closure of the valve can lead to aspiration of fluids, which may result in coughing and/or serious injury to the lungs. Make sure that the safety strap is intact. To determine whether the safety strap is intact, hold the tracheal flange of the prosthesis between 2 fingers and gently pull the safety strap. If the safety strap appears stiff, weak or brittle, or if it shows any kind of damage, do not use the prosthesis and instead obtain a replacement immediately. Regular maintenance. Typically, prosthesis maintenance consists of regular removal, cleaning and reinsertion of the Provox NID. Alternatively, you may also be able to clean the prosthesis in place. However, it is the responsibility of your clinician to prescribe a maintenance schedule for you and to instruct you on how to properly maintain your prosthesis. Make sure that you have completely understood and fully practiced all maintenance procedures under the supervision of your clinician before you perform any prosthesis maintenance on your own. Here is some other important advice for you. Alternate between two voice prostheses in order to facilitate prosthesis maintenance and to reduce the risk of aspiration, shrinkage, and/or closure of the fistula tract. When removing your prosthesis for cleaning, always have a spare prosthesis of the same size and diameter readily at hand, along with an appropriate lubricant and a Provox Dilator. Place the replacement prosthesis and any accessories that you may use during maintenance procedures on clean gauze. Replacing and cleaning a prosthesis. Make sure that your hands are thoroughly clean and dry before placing them in the area of your tracheostoma or fistula tract and before handling your voice prosthesis and/or accessories. Make sure that you have a magnifying mirror and sufficient light to illuminate the tracheostoma. Avoid swallowing while the fistula is open because this may lead to aspiration of saliva and/or coughing. To reduce the risk of such aspiration and/or coughing, try keeping your mouth open, this prevents you from swallowing, or try swallowing before you remove the prosthesis or dilator. Do not maintain, remove, or replace the prosthesis directly after a meal. Manipulation of the prosthesis directly after eating may lead to gagging and/or vomiting. Prosthesis removal. Have readily at hand a clean Provox Dilator of the size corresponding to the prosthesis you have selected, 17 or 20 French. Lightly lubricate the tip of the Provox Dilator with water-soluble lubricant. Avoid touching any part of the Provox Dilator that will be inserted into or that may make contact with the fistula. Carefully remove the tape from the safety strap while securing the safety strap with a finger. After the tape and safety strap are off the skin, hold the safety strap of the prosthesis securely and pull the prosthesis carefully out of the fistula. Never use the medallion thread to remove the prosthesis. Prosthesis preparation. Slowly and gently insert the Provox Dilator into the fistula until you reach the stop in front of the instrument handle. Tape the medallion to the skin away from the stoma. Attach an intact, clean Provox NID onto the Provox NID inserter. Step 1. Secure the prosthesis. Attach the safety strap to the inserter by placing it along the inserter shaft into the strap retainer area and securely closing the strap retainer flap so that it is locked. Step 2. Put the prosthesis on the tip of the inserter. The safety strap should now be under slight tension, not too loose, not too tight. Step 3. Lightly lubricate the tip of the prosthesis with water-soluble lubricant. Prosthesis insertion. If your fistula is situated at an angle within your stoma, you may bend the Provox NID inserter slightly. Be aware that after bending the shaft, you should not rotate the inserter while in use. Carefully remove the Provox Dilator from the fistula. Hold the inserter firmly with one hand with the safety strap release lever pointing upwards. Avoid touching the release lever. Using the inserter, Gently insert the Provox NID prosthesis into the TE fistula until the tracheal flange reaches the tracheal mucosa. As the tracheal flange reaches the tracheal mucosa, you should feel the esophageal flange unfolding. Gently move the inserter back and forth and rotate it slightly in order to ensure that the esophageal flange has unfolded correctly. When the esophageal flange has unfolded, press the release lever to free the safety strap. Gently remove the inserter from the fistula while holding the safety strap of the prosthesis against the skin of your neck. The prosthesis should stay properly in place. Use a piece of tape to attach the medallion and safety strap to the skin. You may also use Provox silicone glue to attach the safety strap to the skin. Clean the Provox NID inserter and let dry. Cleaning the prosthesis following removal. Regular cleaning of the prosthesis helps to prolong device life by removing food remnants and mucus, which can harden and impair the performance of the device. Clean the used prosthesis under fresh water. Use the Provox brush to remove all debris from both the inside and outside of the prosthesis. After cleaning, place the prosthesis on clean gauze and allow it to air dry. Once clean and dry, place the prosthesis in the clean storage box and store at room temperature. Make sure that the stored prosthesis is protected from both heat and direct sunlight. Cleaning the prosthesis while it remains in the fistula tract. Some general notes about cleaning the prosthesis in the fistula tract. Never clean the prosthesis inside the fistula if the safety medallion is removed or damaged. The medallion is a feature of utmost importance for your safety. It helps reduce the risk of injury in the event that your prosthesis dislocates and falls into your trachea. Never remove the prosthesis from the fistula tract without immediately inserting a Provox Dilator or new prosthesis. Removing the prosthesis from the fistula without immediately inserting a Provox Dilator or new prosthesis may result in aspiration and/or shrinkage or closure of the fistula tract, which may necessitate dilatation or repuncture by a physician or other healthcare professional. It is the responsibility of your clinician to instruct you on how to properly clean your prosthesis while it is inside your fistula. Make sure that you have completely understood and fully practiced all cleaning procedures under the guidance of your clinician before you perform any cleaning procedures on your own. Only use genuine Provox accessories when cleaning your prosthesis. Only use a Provox brush that corresponds in length and diameter to the prosthesis you are using. For example, the 17 French prosthesis must always be cleaned with a 17 French brush, never with a brush in another size. Only use a Provox Flush that corresponds in diameter to the prosthesis you are using. For example, 17 French prosthesis must always be cleaned with a 17 French Flush, never with a flush in another size. Make sure the safety strap of the prosthesis is taped to the skin. Additionally, secure the safety strap by pressing it against the skin with a finger. Cleaning in situ with Provox brush. Moisten the brush with tap water, insert it into the prosthesis, and move it gently back and forth with a twisting movement. Never use force to insert or remove the brush. If your prosthesis is situated at an angle within your stoma, you may bend the Provox brush slightly. Be aware that after bending the shaft, you shouldn't rotate the brush while cleaning. Remove the brush, rinse it in fresh water, and clean it with clean gauze. Repeat the procedure as often as necessary. If the prosthesis moves outwards during cleaning, hold it in place with a finger. Clean the brush with water after use, dry it with clean gauze, and then store it dry for the next cleaning use. Cleaning in situ with Provox Flush. The Provox Flush allows you to flush fresh water through the lumen of the prosthesis. Effectively flushing the voice prosthesis helps to clean debris and mucus from the prosthesis, which helps increase the life of the device. Again, make sure the safety strap of the prosthesis is taped to the skin. Connect the bulb with the shaft of the flush. Then fill the bulb with clean, fresh water. Carefully insert the tip of the Provox Flush into the voice prosthesis until you reach the stop. Never use too much force. If you apply too much force, you may push the prosthesis too far into the fistula. Use one hand to hold the shaft of the Provox Flush while you squeeze the bulb. A loose fit between the tip of the Provox Flush and the voice prosthesis may lead to water spillage during flushing. Aspiration of a small amount of water may cause coughing. Before removing the flushing device from the prosthesis, make sure that the bulb has unfolded again and that the pressure between the device and the prosthesis is equalized. Otherwise, there is a risk that you may pull the prosthesis out of the fistula while attempting to remove the flushing device. Asked for their personal opinion, this is what some users have said about the new Provox NID voice rehabilitation system.
I like it because it don't have to put like pressure on it. It's easier to use for talking. And I think it's more secure.
A much clearer voice. I believe to be very much louder. I think a little bit better than the other ones. I have no problems cleaning. Very impressive. But this voice seems to me as if it's I'd say 2 or 3 volumes more than the other voice. I don't know for sure, but try with this. The pronunciation on my words seem to be coming out a lot clearer to me. That's so far.
Provox NID is not intended for immediate insertion at the time of tracheoesophageal puncture. The Provox NID may be contraindicated for patients with bleeding disorders or who are undergoing anticoagulant treatment. A small tracheostoma may make it difficult or impossible to replace a Provox NID prosthesis through the stoma. Please ask for your local distributor. If you have further questions about Provox NID or need assistance, your local supplier of Provox products will be happy to help you.